Hi, thanks for joining me today. I'm Dr. T, Dr. Pamela Terrio. I am the author of, I brought my book today, so I thought I'd flash it, Alleviate Dry Eye. And I'm also the clinical director of the Dry Eye Center at Les Guy Specialists in Shreveport, Louisiana. Today, I want to talk to you about the 5 worst things that you're putting on your eyes. Unfortunately, most of us have done at least one of these before, and the worst part about it is probably that your eye doctor told you to do these things. Technology, it's really moving along at a very rapid rate these days, and so we're learning so many things every day, especially in the area of dry eye. There's new products that are coming out, and we're discovering the things that we told our patients to do even 5 years ago are really not the best ways to treat their dry eye. So today I'm just going to bust a few myths about things that you should be doing with your eyes and tell you some alternatives. So thanks again for joining me. The first is going to be baby shampoo. Now I bet if there was a raise of hands out there, I bet I would get half of you to say that your eye doctor has told you to use baby shampoo to clean your eyelids. Now, we've always known that you need to keep the area around your eyes free of bacteria. However, we used to think you needed to do that by cleansing it away with soaps. Now we understand that we need the oils around our eyes to help keep the front surface of our eye, our tear film, more moist. We need an oily layer to cover the tear film. So we do not recommend using any kind of soap near the eyes. My favorite is the tea tree oil foaming cleanser from We Love Eyes. And if you read the blog that goes along with this post, you'll be able to click the link to get your own tea tree oil foaming cleanser. The other thing that I really hate when patients tell me that they clean their eyes with baby shampoo is they always tell me they use this. And I think to myself, how is someone getting in the mirror and doing these small little circles with a Q-tip? It scares me to death because I know half of the people can't see up close in a mirror without their glasses on. So the best part, the tea tree foaming cleanser, I've shown you 100 times on these videos. It's a little pump squirt onto your fingertip, rub it together, and then over back and forth on your lids and lashes. And then you just rinse that off with water. No soap involved. So that's number 1, baby shampoo. Please, please, please stop using baby shampoo to clean your eyes. Number 2, waterproof mascara. Now we thought that if we could keep the makeup out of your eyes, it would be better, because as an eye doctor, we've seen patients come in and they've got makeup debris in their tear film, and we know that scratching around on the inside of your eye is not good for you. So we told patients to use waterproof mascara because it wouldn't flake into your eyes. Now we know that the parabens and waxes that are necessary to get that mascara to stay on your eyes despite water is going to clog up your oil glands again. So your meibomian glands are a very important part of producing fluid for your tear film, and we don't want those glands to get clogged. Instead, my favorite is the Beauty Counter. Oop, there we go. Beauty Counter Volumizing Mascara. Again, you'll see the link in the blog post. I'll post the blog post below. So, number 3, Vaseline. A couple weeks ago, I went into a long blog post about the worst things to use to remove your eye makeup with. Vaseline was number 1. I can't tell you how many patients tell me that they use Vaseline to remove their eye makeup. Again, you remember all those commercials back like 10 years ago? The eye makeup was non-comedogenic. It didn't clog pores. Vaseline is comedogenic. It's going to clog your pores. It's going to clog those meibomian glands. And the other thing is that Vaseline, another word for that is white petroleum. It's actually a byproduct of when they convert petroleum into gasoline, you get this white petroleum, and now you're smearing a byproduct from a gasoline onto your eyelids. Not good. It's full of toxins, and just don't use it. So, number 3, eye whiteners. Another word for that is gets the red out, Visine, Nafcon A, Opcon A, Clear Eyes, any of those that are just, they say that they get the red out. If that is on the bottle of the artificial tears you used, throw them in the trash. They're terrible for you. The reason is that they contain vasoconstrictors like Vaseline and hydroxyline, and they squeeze your blood vessels on the front surface of your eye closed. So momentarily your eyes look white and bright and wonderful, which you think is a great idea, right? But when you squeeze the blood supply to your eye closed, you don't get any nutrition, oxygen, nutrients, immune response. So you're decreasing the functioning of the front surface of your eye by constricting the blood flow to it. Instead, there's a great product on the market now called Lumify. It's been out about a year, and it constricts the vessels. So, the vessels. Yes. So instead of the arteries, so the arteries are going to be bringing the blood to your eye, and the veins. Sorry, that's the word I was looking for. So the arteries are still open, the blood is still going to your eye. The veins are going to be slightly constricted, so your eyes will look white and bright, but you'll still have all those nutrients getting to the front surface of your eye. Lumify, it's the best one on the market, and the only one I recommend to my patients. So the last thing is extended wear contact lenses. So this little lens right here, night and day lenses, this came out back in the early 2000s. And we as eye doctors, we understood that these contact lenses had 5 times the oxygen permeability of the old type of contact lenses that we had been prescribing to patients. So we thought, okay, you're going to be getting all this oxygen to the front surface of your eye, and therefore it'll be okay to sleep with your contact lenses in. That is not the case. You cannot sleep with your contact lenses in because it's not necessarily the lack of oxygen getting to your eyes that's the problem. It is the fact that the bacteria, the dirt, the dust, the debris, but the bacteria are going to be trapped up against your cornea all night long, the front surface of your eye, and the barriers that we have to protect ourselves are limited when our eyes are closed. So one of the barriers that we have is blinking. We actually can blink. If the bacteria gets in our eye, we blink, it comes out. The other is tearing. So something gets in your eye and you water a whole bunch and it falls out again. So when your eyes are closed, you're not doing either of those, and then the bacteria is trapped underneath that contact lens all night long, and it can just start to cause an infection more easily, more readily. So there you have it. The 5 worst things you could be doing to your eyes, and show of hands, I bet we've all done at least one of those. So now that you know better, you'll do better. And like I said, if you want to check out the blog, there's links to all those better products that you could be using instead. I'd love for you to read the blog as well. And don't let red, watery eyes hold you back from doing the things you love in life. I believe that a customized treatment plan is the best way to alleviate your symptoms. So if you haven't already gotten a copy of my book, Alleviate Dry Eye, it's available on Amazon. You can find me on the web at www.pamterrio.com or in person at Lusk Eye Specialists in Shreveport, Louisiana. Thanks again for watching, and I'll see you next week.